Hello, here we are again, topics in opiate addiction. I'm Dr. Rotchford, and I think I have a great topic today to share with you. It came up over the weekend regarding some young people cutting themselves. There was a woman very concerned about a lot of young people cutting themselves and was wondering what that was about and what could be done for it. And I realized if you kind of get it, that is, if you understand opiate addiction, it's kind of easy to start to come up with some ideas of what might help with this problem of young people cutting themselves, or for that matter, older people. So, what's the connection? Well, today I want to explain a little bit in very simple terms how opiates work, why they work, and what they do, and then we'll come back to this issue of how it might help us better understand why some of these people cut themselves. So first of all, we've got these brains. Okay, and they're affected by different chemicals and substances. And mostly they're designed to be affected by substances that the brain itself makes. Now in the case of opiates, the compound that is similar they're called endorphins. Endorphins affect the same receptors in the brain, the same little, like a key into a lock. The key is the neurotransmitter, the lock is the receptor, if you like. Well, all chemicals that affect the brain, affect certain receptors, and these receptors that opiates affect are also clearly affected by endorphins, compounds that our brain produces to help us feel better, and a whole host of other things. But in any event, basically they mimic the effect of endorphins, what our body produces. Now, it's a complex subject, and I'm not going to get into all the neurophysiology of opiates and how they affect different areas of the brain and which receptors and different type of receptors and all that. You don't want to hear it, and it's really not that important. I think the most important thing for the average person, and in fact I think for the average physician to understand, is opiates are our most effective anti-anxiety medicine. Yes, there's nothing better than IV heroin to cool your jets. Yeah, I mean that. And in this country we say there's no medical indications for heroin. What are you talking about? I'll guarantee if someone's anxious and a lot of pain and you give them IV heroin, they're going to feel a lot better. Thank you. There's nothing. Well, if there's something better for that purpose, there may be something less likely to be abused outside of the hospital setting, all the rest, but it's pretty well toward the top of my list of substances that can help people feel less anxious. So that's how opiates work, also with pain. So the patient has just had surgery. You come around, you do your rounds on them. Mr. Jones, how you doing? I'm okay, Doc. Well, do you feel anything, Mr. Jones? How's your stomach feel? I feel, but I'm okay. Yeah, I don't care. In other words, they're kind of in that state of nothing's bothering them. That's what I say, potent anti-anxiety medicine. Now, the normal average individual, when they're less anxious, will be kind of sedated, or actually will kind of want to go to sleep. This makes kind of sense when we're safe and we're comfortable and relaxed and we're not anxious, and especially when we've been under more stress or more active and someone cools our jets, we kind of relax. Well, of course, that's normal. People who are predisposed to opiate addiction, we know, often have the paradoxical effect. That is, they become animated. They go, let's go party. They really feel good. If someone has that energizing effect by opiates, we know they're much more likely to develop the disease of addiction. Also, obviously, if people have other reasons for feeling anxious more than the usual, whether it's other mental health conditions, medical problems, situational issues, they've had serious trauma, it makes sense that they'd be more susceptible to opiates. It makes sense to me. Especially if that's what they do. They're potent anti-anxiety medicines, and in that feeling of being safe and all the rest, hey, it feels good. In fact, it's supposed to feel good, to feel safe. So, this is kind of how it works. Opiates are anti-anxiety medicines. As a result, they're effective pain medicines. They can help a whole variety of issues. But basically, people are anxious and stressed out. They take an opiate, they're going to feel better. All right. How does this relate to this notion of young people cutting themselves? Well, coming back to what I said at the start, opiates mimic the effect of endorphins. Endorphins are released when people cut themselves or experience pain. It kind of makes sense if you think about it, that from an evolutionary standpoint, our body would help us maintain its sense of awareness and be able to deal with the trauma or the challenge in front of us by producing these chemicals that help mimic that stress response, at least temporarily. So, in any event, whatever the reason, when you cut yourself or you experience pain, endorphins are released, dopamine goes up in the nucleus accumbens. Now, it's that rise in dopamine suddenly and acutely that's associated with substances that produce addiction. In fact, no substance that we know of that creates the disease of addiction does so without creating this dopamine surge in this part of the brain we call the nucleus accumbens. So when you cut yourself or injure yourself or have sex or eat a bunch of sugar or do some aerobic exercise, your body produces endorphins. Now, some people, if that surge is big enough and they're susceptible, they can kind of get addicted to some of this behavior. It's the same thing why people get addicted to gambling. There's a little surge of dopamine when people take that risk. It's part of our learning apparatus and helping us make good decisions and looking at context, and it's all regulated by dopamine. Indeed, let me tell you, you got to be somewhat smart to be able to get addicted. And if you're really smart, like genius level, oh my gosh, you got a real problem dealing with your addictions because you've learned so well it's hard to forget. So that's just to know. You can't be too stupid if you're addicted. That's countercultural ideas about it. In fact, yeah, this notion of cutting, like, how could they be so stupid? Why would they do that? Well, if you get it, it's understandable. We all want to feel better. If we're anxious, we don't know how else to feel better, and we've learned that this helps us feel better and it works, well, why wouldn't you do that? Well, because it hurts you. But it helps me feel better. I think a lot of people do a lot of stuff that's maybe not the best for them because it feels better. In fact, sometimes they'll even become overzealous in their religious practices, really not take care of themselves or others. They get addicted to even stuff like that. I mean, this is human nature, folks. This is how we're made. Okay. Fortunately, by us working together, putting our brains together, understanding these patterns and what it is to be human, and acknowledging our humanity, if you like, hey, there are solutions. For example, what about this thing of cutting? People are talking, oh, we got to go off to some place. It's tens of thousands of dollars. Let's mortgage the ranch here, get some help. Could there be a simpler way? Well, maybe there are ways similar to what we use in treating people who are opiate addicted. I would say people who are addicted mildly to opiates sometimes will benefit from a compound called naltrexone or another variety of that compound's called naloxone. But we're not going to get into those subtleties right here. But basically what these compounds do is they block the opiate receptor in a way that when the person cuts themselves or takes an opiate or drinks some alcohol, that dopamine surge doesn't happen. If that dopamine surge doesn't happen, guess what? The old brain goes, Why would I want to do that? So it really helps some people. There's some genetic reasons why some are more susceptible than others and help more by naltrexone than others. But it's a good bet. So why wouldn't we do this for someone who has a cutting disorder? The reason really I can think of is because it's off-label. It's not FDA approved. Wait a sec. It's been demonstrated to be quite safe. We're dealing with a very disabling, potentially life-threatening condition. Why wouldn't you try naltrexone? I think it's crazy. Just because it's off-label, it's not FDA approved. What are you talking about? It's a good bet. So I think anyone should be given that trial. See if it makes it easier for them not to continue to cut themselves. Now, of course, it alone, just like when we're dealing with people who are opiate addicted, giving medicines isn't the final answer. Because if you don't give people other options for feeling better, if only we say to them, we are not going to let you feel better in this way. That's bad. Don't do that, you stupid idiot. Well, does it work? No. If you say, hey, we're going to make it easier for you not to do that, even better, we're going to give you some solutions that even work better over the long run. You're going to be happier. Everyone's going to be happier. Your brain's going to function better. You're going to meet your potential in ways that you're supposed to. So, as a human being, hey, I think that's an easier sell and more likely to get the outcomes we're looking for. So, there is some good news. Let's acknowledge this is a disease process. There is help for it. Let's do all we can to help people get that help. Thank you for your attention, and thank you for letting me share some of this good news.